delighted to be here and to be hearing from some of the pioneering healthcare organisations in this space. It's very much a learning journey for all of us, so we're not here to hear about perfect finished projects. It's more about what approaches people are taking, how they're finding it, what we can learn from each other. So we really hope everyone's going to join in and get involved in the discussion. Just very briefly like to introduce the team. So I'm Frances Mortimer, I'm the Medical Director at the Centre for Sustainable Healthcare. Victoria Stanford is our QI Education Fellow, and Victoria has done a huge amount to pull the event together. So thanks very much, Victoria. Rachel, do you want to give a wave? Rachel McLean is our Greenwood Programme Manager, and Stacey Harris is our Welsh Clinical Leadership Fellow in Sustainable Healthcare. We've also got our fantastic panellists, Stuart, Laura and Katy from the trusts, but Stacey's going to introduce them in a little bit more detail in a few minutes. But just to let you know a little bit about the event, this is actually the second of a two-part webinar series on embedding sustainability and quality improvement. We had one a couple of weeks ago, which was focused on embedding into education. And this one is much more about embedding into QI in healthcare organisations and in practice. We'd like to say thank you to the Health Foundation, because this is part of a series of actually 4 virtual events funded by the Health Foundation and NHS and NHS England and Improvement, aiming to increase collaboration in the field of sustainable healthcare. So you will very likely already be aware of the Q community the Health Foundation supports, which is a great place to share expertise and learn about quality improvement. And if you are already a member, or if you join, then do go and find the Sustainable Healthcare Special Interest Group, and we can continue to collaborate on there. So in this four-part series, the first event was on remote consultations, and then the second event was on green social prescribing for sustainable healthcare. And there are a lot of resources from those events that you might want to look up. They're really good, including video clips and so forth. And we are today on the 4th one, which is embedding into quality improvement. We are on the welcome and the introduction just now. I'm going to give you a very brief overview of what SusQI is and what work we've been doing already in organisations to support it. And then the main part of the event is going to be the panel discussion. So what is sustainability in quality improvement, or SusQI? It is a framework for integrating into any mainstream quality improvement methodology in healthcare. So what we're trying to do is integrate into existing QI. We're not trying to create a new, a completely new thing. So it's deliberately designed to work with lots of different methodologies. All of them share these stages where in QI you set goals, you study the system, understand how it works currently, you look at what changes you could make, and you measure the impact. And so SusQI can be integrated across each of those steps. And at the very core of it is this concept of sustainable value, where we're trying to maximise the positive health outcomes for patients and populations, while minimising the environmental, social and financial costs of providing care. So we're using all the tools that at our disposal through quality improvement to try and drive up that value. And actually, we find that this is a really good way of giving people structure and tools to navigate what can be quite difficult, as everyone knows, to actually make a real change in a busy healthcare delivery context, there are a lot of potential barriers, and QI can help with planning for, anticipating and overcoming those. And it also, we found that it helps to get a lot of people interested in QI who might not have thought of doing that themselves. And the main thing it does is move us from thinking, gosh, there's a lot we need to change to make healthcare sustainable, into getting on with it piece by piece in a structured way, and measuring and embedding changes. How have we been working with healthcare delivery organisations to embed SusQI? If I could hand over to Rachel just to tell us a few words about the Greenwood Competition, because this is one of the main ways that we've worked with trusts over the last 3 or 4 years on using SusQI. Rachel?
Thanks, Frances. So the Greenwood Competition is for NHS trusts for health boards to join to engage 6 teams, which can be clinical or non-clinical staff or a mix within a team, in sustainable quality improvement. So each team will have a bespoke workshop with us to learn about SusQI and to identify projects that will add sustainable value to their service across the triple bottom line. Teams will then have 10 weeks to plan, run and measure the impact of their project. They'll have support from our carbon footprinting team to look at carbon footprint calculations and savings of their project. And then they have the opportunity to present their outcomes and their learning to the other teams and a wider audience within their organisation. And one team will win a cash prize that they can reinvest into further SusQI work. So we've run Greenwoods at about 13 previous sites before. Some of the sites have run more than one competition, and we have 5 competitions that will be running this year. I won't go through the list of previous projects, but hopefully what you can see by having a quick look at those is we really encourage the teams to have a clinical focus to their project so that they can be adding value for themselves as staff and for patients, as well as focusing on the environmental impact and savings. Could you go to the next slide, Frances? Thanks. So the Green Surgery Challenge was a national version of the Greenwood Competition that ran last year. So that had 5 teams, I think 4 of them from England and 1 from Wales. And again, their projects looked at critical aspects of their work that they could make more sustainable. So as one example, one team looked at eliminating a second blood test from a preoperative pathway that wasn't adding value or changing the outcomes for their patients. Collectively, the 5 teams from the Green Surgery Challenge had prospective carbon savings of about 133 tonnes in a year, which is equivalent to 38 return flights from London to Hong Kong. And I think that's all, Frances. Oh, and coming up this year, so these are the competitions that we've got running at the moment. So we recently finished a competition with Leeds, so their impact report and their case studies of the 5 projects from the teams that took part are on our website. And throughout the year, these competitions will have their impact reports going up as well as they complete their projects. Yeah, I will put the link to our webpage in the chat if anyone wants to learn more or look at any of the case studies.
Thank you so much. Thanks, Rachel. And yeah, Rachel's here with us throughout the session to do if people have questions about Greenwood. But I think it has been a fantastic way both for us to get experience of using using SusQI with teams on the ground and what they find useful, but also to be able to create demonstration projects that you can show to senior leadership within the organisation and show, look how you can bring improving care together with improving sustainability. It can be part and parcel of the same thing, and getting that those local examples. One other thing I wanted to mention was our Scholars and Fellows programme, because that's another way that organisations have been embedding sustainable healthcare, but including SusQI. So organisations can create part or full-time roles, and we then work as sort of providing educational supervision, mentoring and project support with those scholars or fellows. Scholars are the term we use for the part-time people, whereas fellows tend to be half to full-time over a longer period, and they might have a sort of a specialty theme. Generally, at the minute we've got a group scholars program running in Cardiff, and there are 9 scholars there, and they each are developing a SusQI project or a sustainability project using SusQI methods, and we're supporting them throughout the year. Great, I'm going to hand over to Stacey to introduce our panel. Stop sharing. Stacey.
Hi everybody,
yeah.
I'm Stacey. I'm Stacey Harris, and Fanta's already introduced me, and I've got the pleasure of introducing our brilliant panelists. So they are all members from the UK who've been leading the way, and they're going to present their journey of embedding sustainable quality improvement into their organisation. So we have Stuart Lane from University Hospital Dorset, Laura Middlemass, who's from Newcastle Hospital Foundation, and Katy Morris from the Midlands Partnership NHS Foundation Trust. So I'll introduce them in more detail when it comes to their slot. So they're all going to speak for 10 minutes, and that is quite strict. And then we're going to have a panel discussion afterwards. So I'm going to introduce Stuart Lane first. So he's a sustainability and carbon manager, like I said, from the University of Hospital Dorset. And he's previously worked as a business process consultant, which has taken him around the world. He's worked in all sorts of sectors, so from pharmacy to food and electronic manufacturing, the petrochemical sector, and also the public sector. And he's also been involved with some kind of personal campaigns like national anti-fracking campaign, and also some local campaigns as well. So over to you, Stuart. Thank you very much.
Thanks very much, and thanks for the invitation this morning. I do feel a bit out of place when you present, sort of introducing people as being leading experts, but I'll see what I can do to contribute. So as you mentioned, I'm the Sustainability and Carbon Manager for University Hospitals Dorset, which employs nearly 10,000 staff across Poole, Bournemouth and Christchurch hospitals. And I'd like to give an overview of where we are on our journey embedding sustainability within the trust and where SusQI fits into that picture. As I've mentioned, I'm a sustainability manager, but I've got no illusions that I can deliver sustainability in this large and complex environment. It's my role to guide the staff so that they can bring about the changes needed. And I think that's one of the beauties with SusQI, is it's all about giving agency to staff for them to make improvements in the work that they're involved with. So bringing about sustainability in a complex system like an NHS trust requires staff from all parts of the organisation to be mindful of the processes and activities that they're involved with and consider how they can deliver the most benefit and the least harm. And I'd like to run through some of the tangible things we've done at UHD to bring this about. So firstly, we've designed a strategic framework and governance structure, and this is captured in the Trust Green Plan. We've also created a Sustainability Champions Forum to share ideas, raise questions and concerns, and to spread good news. And we've established a network of sustainability ambassadors throughout the clinical areas, and we're supporting them with SusQI training. So currently we're refining how to apply sustainability evaluations to all tenders. And as soon as I finish developing it, we'll be making use of a sustainability impact assessment tool for all major business case evaluations. And finally, we've just launched a sustainability staff engagement platform that we call EcoEarn, which is, among other things, helping to socialize all the measures above and gamify participation within them. So the Green Plan. Last summer, we launched the Trust Green Plan, which really was a step change in ambition and introduced a more rigorous approach to the management of our sustainability programme. The UHD Green Plan is structured in a hierarchy of elements. Firstly, the vision, and the vision statement underpins our whole programme, and it means that the trust services are framed by our responsibility to the current but also future generations. And this was a really important element to frame a broad and holistic remit for our sustainability programme. And next, you notice with our objectives, they mirror the 3 pillars of sustainability: social, economic and environmental. And these 3 pillars run through our sustainability approach at UHD, and you'll see them reflected in our triple bottom line evaluations, including with SusQI. Next, the Cornerstone Targets. We've got our headline deliverables, including the NHS Net Zero targets. We're also using the Clean Air Hospital Framework. We've got targets for waste and energy. We employ the SStat framework for a sort of a broad, holistic approach to sustainability and measurement. But also we've got a specific target for that our staff are empowered and leading change. So again, reflecting how important it is to us to embed sustainability throughout the organisation. And we've got 10 work streams or activity areas, and each of these have their own appointed sustainability lead. And they're working with that SStat tool, working against the targets set in that framework and other targets set out within the Green Plan. So for our governance structure, we've got a steering group made up of the 10 activity area sustainability leads that I mentioned, and that group convenes every month to look at least 3 of those activity areas, meaning that we cover all of them within a quarterly cycle. And then this feeds up to our committee, which is every quarter, and I sit on that with the executive lead for sustainability and board lead for sustainability. And we've also invited in the sustainability lead for Bournemouth University, our local university, and our local authority. And that's been really useful, and we're undertaking a number of projects in partnership with them. And of course, it plays into the whole sort of progress with the ICS programme. I mentioned we're making heavy use of the SStat tool. So although that was retired by the Greener NHS team, there isn't anything better in its place yet. And we consider that to be quite comprehensive and really very helpful. So we've taken the sort of the engine of that old SStat tool and put it into our own spreadsheet, which gives us this dashboard, and we can monitor against in-year targets and multi-year targets. So just going back and just unpacking a little bit that Cornerstone target on staff engagement, you'll note that we've within the Green Plan we've put it into our trust objective so that the staff are actually being appraised against the delivery of the Green Plan. We've also made sustainability or an e-learning module available to all staff in the trust, and we're going to be ensuring that everybody participates in that. And we're delivering face-to-face sustainability training to our sustainability activity area leads, our QI team, and our sustainability ambassadors. And I'll tell you a little bit more about that now. So to set the scene, prior to the pandemic, the Trust had employed the Centre for Sustainable Healthcare to facilitate a round of green ward projects that we've just been hearing about. And these projects employed the principles of SusQI, and I was really impressed with them, really impressed with the outcomes. The teams each learned a lot during the projects, and they delivered a considered and tangible benefits, all framed by the sustainable value equation, which incorporates the 3 pillars or the triple bottom line. And I wanted to find a way to take the green wards from being an exceptional exercise to being business as usual. So working with our transformation team and with board approval, we've added a SusQI training module to our standard SusQI training. And to support the implementation of SusQI at scale, as well as training the SusQI team itself, we've asked for volunteers around the trust and nominated a sustainability ambassador for each of our clinical directorates. So these ambassadors are the next in line to receive our SusQI training, and they're going to be really well placed to support the SusQI projects throughout their clinical directorates. And we're really keen to ensure that we take advantage of levering the ICS structure as well. So our SusQI training is in fact being offered throughout the Dorset system. And continue on that theme of triple bottom line, which is, as we've seen, reflected in our Green Plan objectives, and it's central to the SusQI approach. We also recognise that we need a mechanism to assess other decisions within the trust, not all of which are within a clinical setting or relevant to a QI project. So that's why within the Green Plan, we've committed to apply a sustainability impact assessment to all business cases over £250,000. And the sustainability impact assessment tool is under development, and the approach I'm taking is to incorporate much of the logic of the SusQI process, and at the same time bringing in some additional elements to reflect the social value model. As you're probably aware, from April 2022, our trust, as long as all the others, have been required to recognise a minimum 10% weighting of social value for all tenders. And the guidance employs the social value model themes. So by pulling these into the impact assessment alongside the criteria informed by the SusQI model, I see this as an opportunity to form an interlinking framework, reconciling our approach for clinical QI projects and the triple bottom line evaluations for broader business processes and decisions. As I say, this is being developed, so I won't unpack it any further right now, but I'm liaising closely with Centre for Sustainable Healthcare, and thank you for your support. And I'll be happy to share that template when we've got it complete. Finally, I'd like to tell you a little bit about EcoEarn. So this is a staff sustainability engagement platform that we've just launched in collaboration with the other Dorset NHS trusts, and it's available to our combined staff base of 24,000. There's a link there if you want to dip in and have a little look at it. The animation tells you a bit more about it. But essentially, EcoEarn offers an opportunity for staff to undertake a range of activities, all of which have a sustainability or wellbeing theme. And this helps to thread together the various elements of our programme and socialise them. So, for example, staff are awarded with points if they read the Trust Green Plan, or they undertake the sustainability e-learning module that it links to. And an individual points score and that of the team that they're in is shown on a leadership board, and at the end of the month we award prizes for those that have done the best. And over the summer we're going to be adding in activities to promote the SusQI training, and also reward staff for registering a SusQI project, participating in a SusQI project, and then sharing the results of that project. So we see EcoEarn as a really good opportunity to reinforce the various threads of our approach, and adding an element of fun and competition. So I hope that short run through of our work today is helpful, and I look forward to sharing with you and learning with you as we go.
Oh, thank you so much, Stuart. That was really, really inspiring, and I'm hoping that my hospital takes on many of the things that you've discussed there. Thank you very much. So next is Laura Middlemass. So she's the Assistant Sustainability Manager at Newcastle Hospital's NHS Foundation. So she's got a wealth of experience in sustainability, and that's been focused around project management, engagement, and communications. So she's worked in the Energy Trust and 6 years as the part of the Newcastle Hospital Sustainability team. So she currently coordinates the programme of change management and engagement activities to embed sustainability in the culture of the organisation. And that's in line with the ambitious climate emergency strategy to achieve net zero carbon by 2030. So I'm really looking forward to hearing what you have to say, Laura. Thank you.
Thanks a lot. I hope everyone can hear me all right. So I haven't got any slides to share. I'm just going to give a quick run through really about how it's very much echoing what Stuart's just said about the approach to embed sustainability into, you know, everything that we do here at the Trust. So we have a climate emergency strategy. That's essentially the same as our green plan. And a key strand of that is to inspire, inform and empower our people to deliver sustainable healthcare. Because as Stuart said, you know, we can't do it ourselves in this one sustainability team. We very much, you know, understand that it's going to have to become part of everyone's role, and you know, the work that everybody does, and their sustainability will become part of that work. So we've also identified that we need to upskill our workforce and empower them to be able, so that they can make the most sustainable choices when they're going about their roles. We also have a QI department in this trust, obviously, like most will, and it's called Newcastle Improvement, and they are all about supporting staff and teams to improve, you know, patient care and so they can work in a better way, and they take the approach of you know, training and upskilling staff. So there's a lot of synergies between the way that our department and that department works. Neither of us are wanting to kind of take on the whole, you know, they're not going to deliver all of the improvement and we're not going to deliver all of the sustainability. It's about making sure that staff have got the skills and the knowledge they need to be able to do that as part of their roles. So it's really obvious, you know, to us that if we want to empower people to deliver sustainable healthcare, that we're going to be using, you know, the same quality improvement model. So, you know, they'll be looking at building a team and making sure the right people are in that team, making sure they understand, you know, how things are done now, and testing ideas using the PDSA cycle, and then sharing those ideas so that we can, you know, make it sustained, you know, throughout the trust. So what we've done so far is we've linked anyone that's interested in doing anything around improving the sustainability of the way they work, whether it's their service or procedure or ward, or, you know, whether it's looking at a much higher level, a whole department maybe. So we would always link through to the resources that are available for Newcastle Improvement. They've got bite-sized training, they've got more in-depth courses, they've got lots of resources around how to do quality improvement. So we're not trying to duplicate what's already been done. And we've also developed a toolkit for that around how to do SusQI. So that follows the model that Francis was sharing at the beginning, you know, an explanation of the triple bottom line and examples of how you'd apply that in practice, and the types of things you can measure, how you could maybe, you know, measure carbon footprints, that sort of thing. So we have a toolkit available. And we've linked in the new Centre for Sustainable Healthcare ESR module that's available now on SqI. That's linked in with our training resources as well. So similarly, again, to Stuart, we've got a range of training available. We've got a network of Green Champions, and we've got Green Champions Plus that have more in-depth training. And SusQI is part of that training suite of training. So at the moment, I would say that we are really quite good at signposting between the departments. So we have Newcastle Improvement, we have Sustainability, and we link to each other's resources. What I think we're not quite there yet with is truly embedding it into the work that Newcastle Improvement does. So one thing that we know that we're going to focus on is reviewing the training and the materials that the Newcastle Improvement provide, and making sure that sustainability is part of each module that's there. So sustainable will become one of the you know, outcome of a QI, you know, similarly as it should be, you know, improving patient safety or staff well-being or financial sustainability. Then, you know, environmentally sustainable will be one of those outcomes that teams will be learning about. And it will become part of the measurements module, so will help teams to understand how they can measure sustainability. So that's good. I think that will be a big improvement on what we're doing currently. And then the other thing that we're going to do, we've just started to do, is to really take a directorate level approach to embedding sustainability into what directorates do. So we've produced a model of what good looks like, model for sustainability for directorates, which is 10 steps that a directorate can work through to embed sustainability in what they do. So it's taking a similar approach to how you would look at, you know, a small business really, and some of our directorates are quite large. So you know, it's about having a lead for sustainability improvement in a directorate, bringing together the group, having an action plan, providing training, having an action plan of projects and measuring the improvement. And obviously, when it comes to delivering those projects, we would be using the QI approach to that. So that will be, you know, much more embedding the whole QI methodology throughout, everything that a department or directorate is going to do when they look at how they can improve sustainability. So they'll start by addressing their biggest impacts, and obviously they'll need support from the sustainability team to understand, where the biggest impacts of those of their department is. Is it travel? Is it to do with single-use plastics? Is it to do with energy use? And we can really help them then target their projects in them where they're going to have the greatest impact. So I think that that's probably a fairly fair reflection of where we are with embedding QI into sustainability. We've definitely made a start, but I think that there's a little bit more that we could do to really make it, sustainability of SusQI embedded in all QI, and that's what we want to see. Rather than them being seen as two separate strands, that all QI will be SusQI.
Laura, that was really another inspirational talk, and it's lovely to hear about all of the different things that you've got going on in your hospital. Thank you. I'm sure we'll hear more from you in the panel discussion. So next, we have Dr. Katy Morris. She is Associate Director of Continuous Improvement and Sustainability in the Midlands Partnership NHS Foundation Trust. So she's worked across the Midlands in QI and clinical performance for nearly 20 years. And this has been in mental health, acute care, community care, and what was the Strategic Authority. So she's got a wealth of experience and background in environmental sustainability, and that includes lots of different qualifications, including a master's and a PhD. And I'm really looking forward to hearing what you've been doing in your hospital.
Thank you. Hi, everybody. So I wanted to share our experiences to date. Listening to Laura and Stuart, I think that we really are just starting our journey in embedding SusQI into our QI practice. What we're wanting to address is making sure that SusQI is in everything that we do. So very similar to the speakers we've heard already. So our training, our events, projects, program management, business planning, our quality awards, everything. A little bit of context first. So we've been practicing QI in our organisation since 2013. It was originally based on the Virginia Mason form of Lean. We've got a small QI team, and we've recently appointed a green team with a sustainability manager and a project officer, and both of those teams sit in the continuous improvement portfolio of the trust. To date, we've trained roughly 40% of our 9,000 plus staff in QI, and we've got 3 levels of training. First steps in QI, and we've trained 2,600 people, I think. Leading QI, which is a bit more intensive, and 250 people are trained in that. And then we've got masters in QI, and we've got about 50 people. And QI activity in NPFT can be anything from a large-scale change project with multiple partner agencies taking months to complete, or it can be a team level or an individual level. And I think at any one time, we've probably got about 20 projects in QI on the go, on top of any improvement work running through our clinical and practice network and our ICS partners. So it feels like we're doing a lot of QI, and now we need to move into doing a lot of SusQI. So probably about 2 or 3 years ago, our sustainability manager and I were talking about how then QI might help the SDMP, the Sustainability Management Plan. And I actually found Frances's paper online in the Future Healthcare Journal, and that's how I first found out about SusQI. So I did the SusQI training myself, which I thoroughly recommend for anybody. And having done that, it became clear that SusQI would perfectly complement what we were already doing in the organisation. We just needed to add into our bottom line, as it was then. Stuff got in the way, so jump forward 2 years, and we've now got net zero in our trust strategy, it's in our quality strategy, it's in the objectives of the continuous improvement portfolio. And I think what's going to help us is we have got this robust framework in place we do all of these projects, we've got all of this training, we measure the projects for 30, 60, 90 days, we report them out at service level to committees, to board. The organisation is completely positive about QI, and most of our executive and senior leadership team are QI masters. I think what's also going to help us now is we've got virtual training packages already due to COVID, so we can reach more staff, and we've got events timetabled in to share QI successes, such as QI cafes and things like that. So what our future plans include is adding this SusQI element into our current material. We do need to add in some of the SusQI tools. Many are very similar to what we've got already in the project forms and process mapping and driver diagrams, etc. But I think we do need to become more familiar and confident with the environmental impact tool, for example, and the recognising resources tool. So we've been piloting these with some small team projects recently, such as pharmacy, reducing medicine waste and reducing car travel to collect prescriptions. And we just added in some very simple metrics into our usual target progress reports. And as I say, I think we need to get people more familiar with carbon counting and the calculations involving the various emissions factors. But by doing these small projects, we are becoming more confident in using carbon footprint of a bed day, for example, or the emissions factors based on NHS financial spend, or the average emissions per kilometre travelled by a car. So these things people were doing in their QI project anyway, but they were just measuring them in terms of staff time or financial saving. So all we're going to do is add in this new measure, so expanding that bottom line. We've had a go at retrospectively measuring what the carbon reduction would have been on a project that's already near completion. So taking those measurements that the teams have already made, such as length of stay, for example, and then talking about, well, what will be the carbon footprint impact of that. In terms of the next steps then for the next 12 months, we really need to focus on the training, so getting the SUS part into the QI training and continuing to work on those projects that are already on the programme. We are planning on doing some projects starting from scratch with the SusQI tools based on drivers within the green plan, such as Stuart and Laura have talked about. We're developing a green web page and a dashboard, so we want to share the SusQI successes and case studies and stories quite quickly. And we've also added SusQI project completion into the criteria for our staff quality awards. In terms of engaging people who are not part of QI, because we've got lots of people who are very passionate about QI, but for those who are not, we have got a sustainability champions group of about 50 staff, so we'll be asking them to learn more about SusQI and the other opportunities through the centre. We've also got a greener clinical practice group, so that's a group of clinicians who want to make changes, so we'll be using SusQI for that rather than a usual programme project management approach, and they'll have mentors, they'll be supported through their service and their care groups, and we'll report that to the strategic sustainability group and trust board. And finally, we also want to start sharing SusQI with our student nurses. So in their clinical practice in district nursing module at Keele University, we've been asked to do a half-day training session with them, and they do a small project. So we're going to propose that they do a small SusQI project. And really, I just want to finish by reflecting on the previous webinar on clinical education, and there was just so much that was being done then and talked about then. So I want to be sure that we've got SusQI built into our framework, so that when colleagues join the trust, they can continue to do the practice that they're trained in and they've used elsewhere, and really making sure that's available through the whole variety of avenues, so training, the clinical and practice network, projects, topics on huddle boards, awards, and really that constant communication throughout the organisation about sustainable quality improvement.
Wow, thank you, Katy. Another inspiring presentation. There's so much going on, isn't there? Brilliant. So you've all been on quite a journey, And I'm sure it has been a journey, and I'm sure it's, you know, you've talked about all the amazing things that are going on, but I'm sure there has been some challenges and some barriers along the way. And I was wondering if you'd mind sort of talking about some of those barriers and how you might have overcome them. And could I just, because you're here, Katy, could I start with you, and then Stuart and Laura, could you please chip in? You know, you might have similar barriers or new ones, so please go ahead.
Thanks. I think it's going to be the confidence in using the new tools. As I say, we've been doing QI since 2013, so people are very familiar with what they already use. I do think our current measurements are really straightforward, so people doing a QI project, they can see it and count it and measure it in minutes and miles. It's not so tangible with CO2 equivalents, and I think when it comes to the maths as well, I'm not sure, is a kilogram saved right, or should it be 100 or 1,000? You know, what's more realistic? And I also think, because we haven't got a handle yet on the current carbon footprint of certain services across the trust, it's not like a QI project where if you reduced a patient journey from 10 days to 2 days against a target of 3 days, you know you've done a good job, you know you've got the project right. But if you make a saving of 10,000 kilograms, for example, you know, is that good? Have I already achieved net zero for the whole organisation with my project, or is that the equivalent of shaving a minute off an 18-week wait? So I think it's that language, and the currency is unfamiliar to people yet. But I think that's easily rectified with the training and connecting with the centre, carbon literacy, and just sharing the simple projects that we've done and talking about what does that mean, and you know, what's it the equivalent of, will just get people to be more familiar, I think. So I think that's our main challenge, how new it is and how unfamiliar it is to people.
Yeah, thank you, Katy. That's really insightful. And yeah, I'm sure that this will definitely improve as people get more attuned and yeah, get that carbon literacy, just like we use money, isn't it? Stuart or Laura, what do you think?
I think that I would definitely agree. I think that what Katy says is that it's new language, and having that context of how much of an improvement. I mean, people will calculate a carbon footprint improvement, or a reduction in waste, but then they always will caveat that with, I'm not really sure if this is how much this is really. So yeah, I think that is definitely a barrier. And the other one, I think, it's just the same barrier that there is to doing improvement work generally, which is staff finding the time. There's definitely the willingness and the understanding of the importance, and there's definitely a lot of keen people wanting to really take action on this. But things tend to start off with a lot of enthusiasm, but then actually finding time to see things through is quite a challenge. But I think that will improve. We're also seeking to have some clinical leads for sustainability, and I think that will really make a difference in this area.
Yeah, so I like to give a flip side to the time constraints, which obviously it's always a pressure, but I think that there's a real energy around working with sustainability, a real enthusiasm, and I think a bit like sort of going for a jog in the morning, it can be difficult to get motivated to do it, but then you end up with more energy at the end of it. So I do see that, potentially we can put time into this and get more back, and that's certainly the way I like to pitch it. But people enjoy the experience, and it's rewarding, it's cathartic, isn't it, to actually be able to do something that you feel strongly about and you're worried about. So hopefully that helps counter a little bit of the pressures and the burnout that people are experiencing. And it's certainly something that I think management are acutely aware of as well, that this is something of interest to staff, and it's a way of giving them something that is important to them at a challenging time. So there's two sides, I think, to that coin. I think language that Katy was mentioned earlier is important, and it's interesting how people come to sustainability from different angles, and quite often there's running sort of themes with that, be it carbon or be it coffee cups or straws. But however people arrive, I think there's always a little bit of work to do to try and bring people into a common space around sustainability and thinking holistically, capturing all the aspects of the triple bottom line. I find it helpful to have some basic sort of things to hang your hat on. So sustainability is something that allows a process to continue indefinitely. If you can't keep doing it, there's a problem. And that could be at a macro level for the planet, it could be at a micro level, but it's a nice simple rule that people can hang on to. And I know I certainly have certain principles that I use as sort of a guiding light, and I try and share those with people as I go along as well. But again, sort of just creating that common sort of vocabulary, and helping broaden the horizons a little bit for people. At the risk of sounding like a total hippie, I see sustainability as a form of love. It's about a really deep sense of care for everything, everything that's alive, everything that's here, and everything that's to come. So, and when you start thinking about sustainability in that sort of very profound and broad way, I think opportunities pop up, and you start to see things in a different way. So yeah, coming together around a common vision, a common language, is certainly helpful, I think, for breaking down barriers. And
no, it was beautiful, very profound, Stuart. Thank you. There was lots of insights in there. Thank you. So I wanted to bring in Victoria now, because I think she might have identified some questions from the Q&A session.
Hi everyone, thank you so much for the lovely talks. It's so interesting and inspiring to hear from you, and we've had lots of lovely questions, and I think there's been a couple that are kind of on this theme, as Stuart phrased, breaking down barriers, and Laura mentioned specific barriers around finding time, which I think probably isn't unique to SusQI. It's probably a QI barrier itself. But I wondered whether we could answer Artie's question, just building on this theme. Hi Artie, nice to see you on the call. Thinking about specifically where you've all mentioned giving training to whether it's sustainability ambassadors or others, have you actually had difficulty with clinicians finding time to attend training or meetings, or indeed implementing QI, which you've alluded to that has been an issue, but what kind of solutions have we found to that barrier if we've come across them? And I think that's probably to all members of the panel.
Almost arriving 2 weeks too soon, that question, because we're just launching our training sessions for the ambassadors, and I'm hoping that we get them all into those sessions and that nothing gets in the way. But we do have a quite high level support for them. Our medical director has put out the initial sort of call for volunteers for those roles, so it's certainly got senior backing. Of course there are pressures, and I think we're going to have to be flexible and offer. It's not just sort of here's your training session, you've missed it, that's it now. We want to have regular slots, and hopefully if we don't catch people the first time around, we'll catch them at another opportunity.
Yeah, I'd agree with that. Flexible options is probably the way we found to get around that. So we have got we've got a 5-day course, an IEMA accredited course that we run, and we have had clinicians on and other medical staff on that course. But we've also do, you know, a 2-hour course that's just like a real, you know, more about the climate change and science behind that, and then what the, you know, the trust is doing to combat it. And then we've got some bite-sized sessions that is part of our Green Champions Plus. They have a meeting quarterly, and we just do like a really quick half-hour session as part of that. And then we've got some sort of you know, I suppose self-directed things that people can take themselves through and click on links with videos and do a bit of reading. And so we've really tried to just provide like a real variety of ways to get that training across, and to, I think, to really focus on what it is important that people need to know. So, you know, obviously a 5-day course is really quite in-depth, but not everybody needs that level of training. You know, most people need to have an understanding of why the urgency, what the NHS as a whole is doing, what we've committed to, and what they can do to help. And I think if we get that information across, then people will come to us for maybe, you know, a bit more guidance of what can I specifically do in my department, and that's when we would get into, well, how about doing some SusQI, or how about forming a sustainability working group or something like that.
I would absolutely echo in terms of that variety, making the training accessible. I think the virtual training's made a huge difference. I think the other thing on top of that is recognising that maybe not everybody needs training in order to do a SusQI project. And we absolutely want to build it into build SusQI into our QI training. But as I mentioned earlier, the Greener Clinical Practice Group, the people who are as part of that group who may be making changes might not need to do the SusQI training and go all the way through the project. What we'd like to do is for them to gather maybe every other month and just listen to each other and change ideas and support each other. And we've seen some great ideas come forward, which could then be put on a programme for somebody else maybe to take forward. So I wouldn't want training to be seen as the only route into doing a SusQI project. I think we've got ways around that.
Thank you to all of the panelists for those brilliant answers. I think one sort of part B to that question that came up that might be interesting while we're speaking about training would be this idea of how do we actually get, for example, some of our e-learning resources on sustainability and on sustainable quality improvement to become part of mandatory training in trusts. I don't know if one of you or a couple of you have an opinion on that.
Well, we're on a journey towards that at the moment. We've put two e-learning for healthcare modules on to our Beat VLE system, and I mentioned the EcoEarn system, which is I should have mentioned is the Jump platform. EcoEarn is our branding for it, but we're signposting staff to those e-learning modules through that platform, and obviously they're getting recognised and rewarded for that. But we would like to make them certainly the basic training module compulsory for all staff, and probably have a role-based criteria for the SusQI initially, but that is a bit of a work in progress. But by the end of this year, we should have all staff having undertaken the sort of the basic sustainability training.
I think we're quite similar as well. I think the other route in as well, I think Laura, you mentioned it earlier on, in terms of SUS isn't anybody's responsibility, and I don't think it should sit necessarily with the QI because it's SusQI either. So I'm really pleased to hear about green people plans, for example, and talking about the green agenda in recruitment and induction and even exit interviews. And I think because the organisation talks about QI in those spaces as well, we'll have that natural opportunity then to be able to talk about SusQI throughout a staff member's journey. So I'm hopeful that it isn't something that we'll need to push from a SusQI perspective for this training to become mandatory. I'm hoping that that's something over the next year or two, hopefully a year, that through the People's Directorate agenda, that's something that also will work in our favour.
Yeah, I think we probably are heading towards these models becoming mandatory, but at the moment we've taken a kind of different view, that in terms of really it might be interesting to see what the uptake is like when it's not mandatory, and you know, through the touch points that where people do come in, you know, we've got inductions obviously, and then we've got when people go into new managerial roles, they have an enhanced induction, and so there's various touch points where we can do a really training, but a bit of, I suppose, promotion about what doing, and promote the fact that that training is, and then see, you know, it might be quite interesting to see what level of take is like if we don't make it mandatory. So that's what where we're at the moment, but I think we probably are heading towards it becoming part of the mandatory training sort of suite of models that people have to do.
Great, so it sounds like general good news for all of us in all of your contexts about in terms of getting mandatory training for this, but we're probably not quite there yet for all our trusts nationwide, I imagine. A question now, moving more on towards sort of thinking about process, because a lot of us on the call might be just at the beginning of this journey. And as you mentioned, that you are already kind of pioneers in this in terms of embedding sustainability into quality improvement, and many of us are just at the start. So Emma asked a question to think more about the kind of actual steps that you were able to take. So thinking about where you are now, so day one to now, how did the ultimate plan that you're presenting today actually take shape? Or was it a lot of back and forth and failures? Was timing everything? So very sort of, what was the process? Who would like to start with that one? Katy, hi.
It feels as if it's very fresh for me because we've only recently done it. I think it's just fortune that a number of things came together at the same time, and whether it's, I think it's a number of things coming together at the same time and then pouncing upon that opportunity and then really driving it forward and not letting go. So the quality improvement practice of the organisation was very strong. Net zero and the green plan, lots of activity in the integrated care systems. I think those three things, and probably more things at the same time, but all came together that just made complete sense that we embraced SusQI. And then, as I say, starting to read up on it, going on the training, and it just fitting perfectly with what we were already doing, and really is the solution to enable us to go forward and go forward quickly. As I say, for me, it just made sense. To then take those next steps practically, it was getting board support, and as I've mentioned already, you know, we've got great board support for QI and also for the green agenda, so that was straightforward. And I actually met with all the clinical and care directors and managing directors and talked to them about what they would like to see and let them tell me what they wanted, and then offered SusQI as that way of being able to deliver that. And then I think it's getting people really familiar with it and then starting to have a go, as we've done with a couple of pilot projects, and then being able to get clinicians to go and talk to other clinicians about what they've achieved. And then people are saying, so how did you do that? And it was SusQI, and the momentum starts to build then. But I think those fundamental steps are really getting the support that you need and getting a few passionate people talking about it right across the organisation. That seems to have worked for us in the last few months.
Right, that really resonates with me, Katy. And talking about sort of having everything ready and the planets aligning, I often think about the analogy of having things in the wings a bit like a think tank. You know, a lot of government policy has actually been generated by think tanks, and when they're looking for something to publish quickly, they'll reach out and grab something. So and a bit like sort of having your project ready for when grant funding appears and they give you 3 days to return with a bid. Sometimes you have to have done the preparation in the background, and it does feel like there was an awful lot of thought and time went into getting the strategy together, with sort of period of where it was difficult to get traction, and then all of a sudden it took off because of environmental factors that you wouldn't necessarily have direct control over, but the planets align. But one thing I was able to influence and did have a big effect was taking an opportunity with the merger. I knew that we'd have a new board, and try to ensure that we had a board lead for sustainability on the new board. That's been instrumental, and our board lead is very experienced, has also been involved on the board of the Environment Agency, and in fact very early on got him involved with the Greenwood Competition and was a judge for that, and subsequently became a trustee for the Centre for Sustainable Healthcare. So a great tie-in. So we don't really have to sell that to the board anymore, but it's all these things you couldn't necessarily plan, but you can make sort of a fertile environment for them to take shape.
Yeah, I think I don't really have much new to add to that. Definitely, we've got the commitment from the very top, and a really strong improvement department, and improvement is a really key facet of the trust's work, and then so is net zero and the work on the commitment to the climate emergency. So that those two things do make it a lot easier. But yeah, another thing is quite a lot of networking, being at things like, we've presented at the Trust Management Group, so there was an opportunity that came from that the departmental strategies were being refreshed. And as Stuart said, we had this model for directorates, and we had, okay, well, here's an opportunity to tell each department about this model. So you wouldn't necessarily even be able to plan that, but having it ready, and then the opportunity when it does present itself, it means you can kind of take advantage of those as they come along, I suppose.
Thank you so much. So it sounds a little bit like it's kind of those three policy streams coming together, isn't it? Those three streams of kind of opportunity, having that motivation, having that support. So a little bit of timing, but it sounds like institutional support and board support has been extremely important, as well as it sounds like interest and support from the ground and those involved in QI anyway. Thank you to the panelists for those brilliant answers. We've just got an interesting question from Lauren on the chat, thinking about whether anyone on the panel, or even any of our CSH people on the call, whether we've had any experience of training in SusQI training on tools unintentionally being used for greenwashing, and if or how we've designed resources to prevent this. I don't know if any of our panel members or indeed CSH would like to answer that.
I think I don't know that if it was necessarily greenwashing, but I do think that sometimes the green agenda can be used to kind of try and lever and support for something where it isn't necessarily actually that sustainable. So as an example, lots of people, they'll really focus in on something like paper reduction, but actually when you look at, weighing up, it's quite hard to do, actually. It's always say which is definitely the most sustainable option. Sometimes people will say, well, think this is going to have a great impact on sustainability, but actually when you look at it, if you're introducing a load of iPads or something, it might not be. So yeah, I don't think it's. I think it's just coming back to that knowledge not quite being there yet. I'm not sure that it's sort of falls under greenwashing necessarily.
No, that's great. Thank you, Laura. Stuart.
Yeah, just to add, I suppose greenwashing gives the connotation is that it's intentional. And I haven't really experienced that, but I think, but like Laura was saying, sometimes the focus can be on things that are maybe less of a priority. Trying to see the positive in that. I do think everybody's on a journey, and sometimes it just so happens that their introduction on that journey is something that might, on reflection, seem less important, but that's their introduction, so it's important to them, and it might be that's just a stepping stone. So I try to keep that in mind, particularly when you get inundated with exactly the same ideas from multiple people. But it's great that they're having those thoughts and they're coming to you, and I see it as an opportunity to then go back and maybe plant another seed.
Yeah, absolutely. Thank you to both of you. I think we could probably echo a lot of those statements. I'm seeing some fierce nodding from Stacey. Would anybody from CSH like to answer that question? I'm sure we all had some experience of this.
Not had so much experience from. I mean, the target audience for the SusQI work is really clinical teams and clinicians, health professionals and educators, and they've no need to do greenwashing because they don't at the moment get enough recognition for green credentials anyway. It's more likely that would happen with a company that's trying to position itself as being sustainable, and yes, I'm sure that can happen, but that's not really the focus of this work. Yeah.
Thank you. So I want to move on to a question that is maybe from Rebecca. I'm very aware that all of our panel members are working within mainly hospital trusts, but I think it's important to also bring in community and primary care. And I think Rebecca Rhodes has a great question about, have you got any tips regarding how hospital trusts can work closely with the ICS and primary care with SusQI? Any tips, any info, any insight?
From my perspective, Victoria, we're part of 2 ICSs with the Midlands, and we participate in the climate change and greener activity groups through both of those ICSs. So we've got a space where we're talking to other providers and partners. Within that framework, then there's actually a work stream, part of the Green Plan, on workforce and leadership, and I really see SusQI as sitting very strongly in that element of the Green Plan. So at every opportunity at the 2 ICS groups, I will be talking about SusQI as part of that. So hopefully we'll see working groups set up and we can talk about SusQI there. There's been lots of interactions recently with other providers as we've started to meet as an ICS green group. Some people who, similar to us, have done lots of QI but not very much SusQI yet. Some people who've done lots of Sus and not QI. So we're all at the moment just talking to each other and sharing, and I can see that route for me as being the one that we'll go through in order to talk about SusQI and how we could do that with our partners. And just very quickly, we've got quite an established group of quality improvement and continuous improvement colleagues working within our ICSs. So also there'll be a route in then to talk about SusQI in that domain as well. So quite strong again for QI and CI. So how can we talk about Sus in that domain?
Thank you so much, everybody. This has been such an interesting discussion, and yeah, lots of it has resonated with me, and I've learned so much from you all. Thank you so much today. And I wondered if you could all give a piece of advice to somebody or a group of people who are trying to embed SusQI into their organisation. What would your kind of one piece of advice be to those sorts of people?
I think I would start by looking at what QI is happening already. If there is, somewhere where you can see if they're sharing case studies or any good examples of QI, you can, pick out the ones that you think will have had a sustainability impact as well. and either, you know, get in touch with the people and say, oh, your project sounds really interesting, would you like me to help you measure what the sustainability impact was? And maybe you could, you know, you could then promote that maybe to your green champions, or, you know, whatever you've got to say. You know, these 10 projects have happened this year, and, you know, really amazing sustainability impact as well. I think that's a good way of trying to show that QI and SusQI aren't necessarily that different.
I think you know, going from our own experience, two aspects that were really helpful. One was we undertook a round of Greenwood projects with CSH help, so I can highly recommend that. And to take the SusQI training and bring your QI team to that training course. I think those are probably the two most important first steps.
Yeah, I would absolutely agree. All of the above. And I think really just take any opportunity to push SusQI into everything. So tweet about it, talk about it, even as I do now. I'm not very confident in it, but I can see its merits. So just to get it across the organisation as something that we are going to do, we are doing it, we're having a go at it through every aspect that you possibly can. And until it's something that you've actually built in, then there's no harm at all in doing the training and doing a little case study and having a go and talking to colleagues about it. That seems to be working for us.
Thank you all. Those are all really great pieces of advice. Yeah, thank you again. I can't thank you enough, really. So I wanted to hand over to Frances Mortimer now, who's going to talk a little bit about the New Beacon site programme.
Thank you. Yeah, just to echo Stacey's thanks to all of the panelists. It's really exciting. We've been on a really exciting journey. We kind of knew that sustainability and QI should work well together, and we thought about, well, how do they actually fit? What are the mechanics? What are the things that will help people to do that in practice? And then we've been testing it out over Greenwood, and then now to see it being picked up at organisational level and people finding it useful and finding the kind of empowerment side of it that Stuart mentioned it's so exciting. So I'm really privileged to be part of the journey, and thank you very much. Yeah, just to show you how CSH might be able to help you if you're looking for help in your organisation. So it's already come up a few times, and there's some links in the chat and in the Q&A. But we have developed this 30-minute taster session that runs through the 4 steps of SusQI, which is accessible to anyone in the NHS through the e-learning for healthcare platform. And then we run the CSH's own 3-part course. So that's the first part is 4 to 6 hours of self-study materials, which you work through online. That's interactive. And then there's a half-day workshop to practice some of the tools and think about how you might use them in your either in your project or in embedding into your organisation. And then there's a cafe that you can come back to, a work in progress workshop, we call it, where you can bring things that you're developing and get some more input. And then the other thing that is available to everyone, which I hope you've all found, is at susqi.org. There's project resources set out by the 4 steps, and anybody, either you or somebody you're supporting who's working through a project, can access those. And then just to mention that sustainability and quality improvement is one of lots of different courses, and we've got a particular course for teaching and others that might be relevant. But the other thing that we are supporting is really to give more visibility and recognition to those organisations that are embedding SusQI through our Beacon Site programme. So this has been developed through the education project, which anyone who came to the last webinar will have heard a bit more about. Over the last 2.5 years, we've been working in education settings to show how SusQI can be integrated and evaluate that, and then and then to support other organisations to take that on and do it through as beacon sites, but we want to expand that. We're opening it up to healthcare delivery organisations as well. So if your organisation is including sustainability in QI training that it provides, then it could be recognised as a beacon site and form part of that network of sites that can share learning with each other. And there's a small administration fee, but yeah, it really should be hopefully open to anyone who wants to be involved. It essentially involves submitting some evidence for what QI training you provide and how you're integrating sustainability into that. And then that will be reviewed periodically, and you get a chance to network with other beacon sites. So to support organisations, we've already mentioned the courses, and you can block book places for core groups of staff on any of the courses if you want. The Greenwood Competition's been mentioned probably quite enough, so you can do that. I spoke earlier about the Fellows and Scholars programme. That can be a good way to support development either in a particular specialty or in a range of different settings, and again create good practice examples and sort of grow champions, provide a bit of mentorship and support for people. The new thing that we're just launching at the moment, which is open for registrations now and will be getting going in August and September for the coming academic year, is the SusQI Academy. And this is a way of providing support to SusQI leads in organisations. So those are the people, it might be a small handful of people in a given organisation who could be from a QI team or in a QI leadership role or an education role, who are embedding into that organisation, and as well as going on the courses, you also will get some peer support and networking through quarterly forums and some bespoke support from CSH with your work in embedding, but that might take the form of, say, coming along to present to senior leadership, or reviewing training materials and helping to co-design things, or providing some project clinics can be a useful thing, where if you are looking to mentor teams who are doing projects, we could come along to some of those mentoring sessions with you and help to give input and help you get started with that. So that's some of the examples of the way that our current beacon sites have made use of our support, and we wanted to find a way to continue that in the future and open it up to more people in a kind of flexible way. So if you're interested, look up the SusQI Academy, and organisations might choose to enrol one or more people into that. And then the final thing, just to make sure everybody is aware of it, do go to networks.sustainablehealthcare.org.uk and find networks that are relevant to you, and connect with other like-minded people who are working in this area. And of course the Health Foundation Q community with it specifically got a lot of really good people with QI expertise in that. Yeah, so a huge thank you again to our team, Victoria, Stacey and Rachel, and to the panelists. Thank you again for coming.